Alright, let's talk about something that's way more common than most people realize: menstrual cycle abnormalities. If you're dealing with weird periods, unpredictable cycles, or just want to understand what's normal and what's not, you're not alone. So, let's break it all down. First up, what do I mean by abnormal cycles? A typical menstrual cycle lasts around 21 to 35 days. But if yours falls outside that range, comes too frequently, or skips months, that's considered irregular. Some women have super heavy periods while others barely notice theirs. There's also spotting between periods or bleeding that lasts way longer or shorter than usual. Sound familiar? Trust me, it happens to a lot of people. Now, let's dive into the types of abnormalities. There's oligomenorrhea, infrequent periods, cycles longer than 35 days. Then there's polymenorrhea, periods more often than every 21 days. Amenorrhea is when your periods stop altogether. Menorrhagia is heavy bleeding that soaks through pads or tampons every hour or so, or lasts longer than a week. Each of these has its own causes and risk factors, but the impact is real, especially when heavy bleeding leads to tiredness or even anemia. So, what can cause all these changes? Hormones are usually the main culprit, especially estrogen and progesterone. Stress, extreme exercise, eating disorders, travel, PCOS is a really common reason for irregular periods. Thyroid problems, certain medications, and sometimes just genetics. Some risk factors you might not realize: being underweight or overweight, rapid weight changes, chronic illnesses like diabetes or celiac disease. Age matters too. Teens and women approaching menopause often notice more irregularity. So when should you worry? If your cycle suddenly changes, you bleed between periods, your periods are super heavy, or you skip 3 cycles in a row, it's time to check in with a healthcare provider. Periods that are accompanied by severe pain or symptoms like fever also deserve attention. Let's talk about treatment, because there's hope. The best approach depends on the cause. Sometimes managing stress or adjusting your exercise routine can help a lot. For hormone imbalances or PCOS, your doctor might recommend birth control pills or other medications. Thyroid issues need to be treated at the source. And for heavy bleeding, iron supplements, anti-inflammatory meds, or even minor procedures might be part of the plan. The bottom line? You don't have to just deal with it. Menstrual cycle abnormalities are common, but they don't have to run your life. Track your cycles, listen to your body, and don't hesitate to reach out for help if something seems off. Taking charge of your health is always the right move. Thanks for watching. If you found this helpful, hit like and subscribe for more straightforward, judgment-free health info. Stay healthy and empowered.